My name is Dr. Shamsa Malik. I am a DNP and NP at Harbor UCLA Medical Center, Department of Hospitalist Medicine. The co-presenters for this poster are Dr. Suzette Klassner, Dr. Marian Brecht, Dr. John Lazar, Dr. Edward Zurich, and Dr. Richard Lawson. This poster represents a quality improvement pilot study that we did with the hospitalist providers at a county hospital in Los Angeles, aiming to increase the co-prescription of naloxone and education regarding overdose prevention amongst patients who are at risk of opioid overdose. The study started with a baseline knowledge, attitudes, and various surveys that our providers reflected on perceived behaviors or practices that prevent them from co-prescribing naloxone or educating patients about opioid overdose. We also assessed patient charts to review what is the rate of opioid prescription as well as naloxone prescription. Then we did an educational intervention and then reviewed both of the data from the charts as well as repeated our surveys post-intervention. Through the intervention, we introduced a novel 5-step process which was customized to the hospitalist setting and made it easier for them to follow a process which was systematic in whenever they were choosing to write opioids. And would trigger them to also co-prescribe naloxone if the patient met a particular criteria. We saw after our intervention that the providers reported higher level of confidence in co-prescribing, in identifying the risk factors that put a patient at risk of overdose, as well as endorsed a higher confidence in educating patients about overdose education. Similarly, in the chart reviews post-intervention, we saw 80% more naloxone co-prescriptions when compared with our baseline, and more than 40% education around overdose to patients when compared with our baseline. This pilot study can be scaled to other medicine teams to utilize this 5-step approach in a very consistent way to screen for overdose and co-prescribe naloxone, and we met our goals and aims that were set out at the beginning of the project.